Hi, I'm Lauren, the Senior Media Liaison Officer for Nepean Blue Mountains Local Health District. Today we're bringing you our Year in Review video, which is a snapshot of what we've been up to over the course of the past year, including some staff achievements and of course some fantastic redevelopments that have taken place right across the local health district, one of which is the fantastic new East Block behind me. I hope you enjoy the video.
With the design, it seems to work. Will it work as a building? Well, we still have to put it through its paces, but I think at present it looks terrific. The artwork, the river photos and things around the walls, it really does look terrific.
Whilst it was fantastic to have all the politicians here and to have an official ceremony, it's really only a marker for, I think, a new beginning for the LHD overall. So we've had health reforms that have created local health districts, we've got Medicare locals being established, we've got a whole lot of new structures and new people involved, and for me as the CEO who's been here 14 months now, it's just a fantastic time to be here. There's so much happening, there's so much, I guess, spirit returning to the organisation that it really is a pleasure to lead.
My name is Edward Davidson and I'm a senior physiotherapist within the Multidisciplinary Orthopaedic Clinic here at Nepean Hospital. In this past year we've seen some successes in providing some allied health interventions in preoperative management and referrals for some conservative programs such as hydrotherapy, lower limb exercise classes to help prepare the person before their elective joint replacement. Across the program we are providing some chronic care management. And so these are providing some strategies to help manage before surgery and for after to improve their outcomes in recovering from their surgery.
My name is Shelley Boyle, I'm the Senior Outpatient Physio at Nepean Hospital. We've moved department, so that's been exciting this year. As you can see, we've got a beautiful new department with lots of light through it. And with the new building just over there, we've got the plastics clinic that's now situated with the doctors, so the hand therapists are right next to the plastics clinic, so it's better for patients and the therapist and the doctors because they can all work together without having to send the patients off to find the physio.
My name is Anwar Hassan. I'm one of the senior cardiorespiratory physiotherapists in Nepean Hospital. We've seen a lot of change. It's gone from one area health service to the other area health service, and before it wasn't too bad, but again before we kind of felt a little bit scattered in terms of it was a big area health service, but now we moved to a different area health service, local health district. We've got a new RC unit which is state of the art at the moment, so I'm quite lucky to be a part of that, and because of that we've got extra physio position funded to the RCU, which is really good. We were able to provide what we wanted to provide, like a good quality care to our patients. We were able to achieve our targets, and I think I couldn't ask for anything more.
Another very exciting development for Nepean Blue Mountains Local Health District is our brand new intensive care unit. The new ICU at Nepean Hospital has state-of-the-art facilities and we think is the best in the state. Ian Seppelt explains more.
The exciting things for 2012, as you can see, are our wonderful new intensive care unit. We have now been in this unit for some months. We've got a fabulous new 12-bed facility, which is where we're standing right now, plus we renovated our other 12-bed area, so we have a 24-bed intensive care unit, which is bright, modern and beautiful for the patients. We're just in the process of completing a new education facility as well, which is straight upstairs. So when that's completed in the next month or two, the entire Department of Intensive Care will include our 24 ICU, an education and simulation lab, plus all the research facilities that go with that, and that's extraordinarily exciting. Our ongoing project is now to computerise the intensive care completely with the introduction of a computerised medical record. That's still in progress, and there have been some teething issues, but again in the next few months that will be complete, and we'll be happy that we have a 21st century state-of-the-art intensive care facility.
So my history with Nepean Hospital was that I actually started here as a student in 1997. At that time I was one of about 12 students, and then I was one of 12 interns in the year 2000. And here we are in 2012, where we're about to employ 107 junior doctors. So it's a really exciting time. We went from a tiny small building where we had a demountable to now a beautiful clinical school and a beautiful new unit and a beautiful East Block. So I think that for the junior doctors in the future, this is going to be an exciting place to practice and work and become part of the community.
Hi, my name's Lizzie Barrett and I'm the new nurse educator of ISET Nepean. ISET stands for Intensive Care Education and Training, and we're fabulously excited because our new facilities, which are just up there, are due for completion in only a few more weeks. The space upstairs contains a brand new simulation lab, a couple of lecture theatres and our multimedia unit. And this is fantastic news for the Area Health Service because simulation is such a great way to train our staff. We get to train nursing and medical staff in a creative, innovative and fun environment to make them better clinicians for our community and their patients. So let's go take a look at the new facilities upstairs. Walking in the entrance here at ISET, you'll notice the fabulous red ceiling. One of the things we really wanted to aim for was a bright, exciting space. We've designed the simulation space to represent an intensive care bed. This makes training exercises far more realistic for our clinicians. The lecture theatre space is so exciting. It's filled with light. The floor to ceiling windows make it a really fabulous learning space for our staff here in the hospital.
Up here in Nepean Hospital, actually in the drug and alcohol department, we provide a detox service. So we help the clients to come in, assess them and plan the detox program for them. Also we run groups, educational groups here at Nepean Hospital, relapse prevention and smart recovery. And they run here and we introduce this service to the clients as well, give them the times and the dates and what to expect. So we encourage them. It is quite lucky to be able to have in the West here a service like this, especially we don't have that many services, and that of course puts more strain on the service, but the support of the service is crucial.
Maintaining a sense of community spirit and a local hospital feel is vital to the delivery of successful healthcare across the local health district. Chris Addison from Blue Mountains Pathology explains.
My name is Chris Addison. I'm the Chief Hospital Scientist. I've been working here now for greater than 22 years. I came from a private practice in Penrith, which was a very good private practice, but up here it's just been very fulfilling for me. It's a very well run hospital, everyone gets on well, all the staff love each other. My staff in particular are very dedicated. It's a very good bread and butter pathology practice. You know, we don't split the atom here, but what we do very well. And we're all proud of it. Yes, we look after the people of the local district. You know, I do run a clinic for people with hemochromatosis, and by running it, I look after 67 patients here. And because I do it here, they don't have to go down to Westmead or Nepean or anywhere else. It saves a lot of travelling time because often those people are quite sick, and it's detrimental to their health to have to travel somewhere else. So, under the guidance of the general manager, I've been very lucky to keep that clinic going for 16 years.
You might have been driving along Derby Street recently and thought, what is this construction going on at Nepean Hospital? Well, the Nepean Blue Mountains Local Health District has been very fortunate to have had a great investment in mental health services across our district, and this development is just a part of that investment in services. Our new mental health building will replace the existing Piala unit at Nepean Hospital, Darren Egan, Nurse Unit Manager of Piala, has more on this now.
My name's Darren Egan. I'm the Nurse Unit Manager for the Piala Mental Health Unit that's behind us. Basically, it's a 33-bed unit that basically cares for the people of the Nepean Blue Mountains Local Health District. I would say that some of the positives that we've certainly had over the last 12 months is that we've been able to care for some acutely very unwell people and basically liaising with their families and loved ones. We've been able to get these people better and reintegrate them back into society. I think we've been able to do that within the constraints of this is an old building, but looking towards the future, we've got a new mental health facility being built here, which will not only basically be for adult mental health services, but also for older age clients in the community. So, which would be fantastic. I think if we look at outside of Piala, we've got a fantastic, community resources from Lithgow all the way through to the plains, and certainly our focus is on building on our strengths. And I think we've certainly got some outstanding people. We've got fantastically experienced people that work here, and I think it's just building the service around the actual strengths that we've got. So
there you have it, our year in review. While Nepean Blue Mountains Local Health District may not have the largest hospitals in the state, facilities such as this one, Nepean Hospital, have been built from the generosity of the local community, which makes us proud to deliver health services back to you.